أرحب بالجميع وأرحب بالطلاب.
Of course, the colonizer looks at the Africa from above. I am, mashallah, and I see these are down. Let us see what I can get from them. Instead, Comboni has a different way of looking at Africa. Not as someone who is above and tries to think how to benefit from them, but he discovers that African people were brothers and sisters, that we have a common Father in heaven.
We really encourage you to try your level best to benefit from this opportunity to the maximum by using your time and capacity properly. Remember, you are the managers of your time. You are the managers of your lives. And remember, God helps to those who help themselves. Finally, we really long to welcome you with open heart and mind in St. Mary's Maternity Hospital.
We have two full-time lecturers. Ahmed is a medical and surgical nurse. Izad is a medical and surgical lecturer. Also, we have...
Good morning, everyone.
Good morning.
Are you happy?
Yes.
Are you happy to be here?
Yes.
Do you want to be nurses?
Yes.
Do you know why you want to be nurses? Do you know why you want to be nurses? I can't hear.
Yes.
Do you know why you want to be nurses? Ah, we want...
Good morning, everyone, and a warm welcome to all the nursing students. My name is Elisabetta. I am a nurse working with ISPO NGO, and I'm honored to participate to the inauguration of the Bachelor's Degree in Nursing of Comboni College. In the framework of a 2-year international development project that is funded by the Italian Cooperation, ISPO is supporting the Comboni College providing technical assistance in nursing curriculum development. The goal of this partnership is to strengthen the effectiveness of the educational system for the nursing student from the university side and to improve the quality of the nurses' competencies and patients' outcome from the hospital side. The idea is to develop a tutorial system that will facilitate the clinical learning of the students that can occur both in real setting and in simulated settings, so can be implemented in the ward of the hospital and in the skill labs. The process will involve all the stakeholders, the institutions, the nurses from the hospital, the academic staff, the civil society, and the students as well. The implementation of this tutorial system starts from the adaptation of validated and international models to the reality, to the needs, to the real needs, and to the resources that are available. At the center of this tutorial system, there is the student, and we can see this system as a pyramid in which we will have the students in one side, then we have the clinical staff, the nurses that are working in the wards as a clinical tutor, and the academic staff, nursing academic staff, as clinical mentors. These figures work together to support the clinical learning of the students. This system is part of what we call the mentorship and tutorship program. So what will be the next step? What we are going to do to implement this mentorship and tutorship program? We will work to organize a clinical practice internship experience in which students can learn by practicing on the real patients in a safe environment, because they will be followed directly by the clinical tutor, so the nurse that will be responsible for that student and that patient, and they will be followed, supervised by the clinical mentor in an indirect way. The background idea is that we can learn nursing only by doing nursing. respecting, of course, the patient's safety as a priority. I wish you all the best for this new start, for this new experience, and looking forward to working together as soon as possible. Meanwhile, greetings from Milan.
Hi, I'm Katie and I've been a nurse for 33 years in the UK, in Australia and here in New Zealand. The last few years I've worked in palliative care, which I think has probably been my huge passion for nursing. I've now moved to nurse education for overseas nurses and I'm hoping that passion follows me. I've always been really interested in educating nurses and bringing out the best in people. So I think your project is absolutely super exciting and good luck, and I think you'll all be marvellous.
Assalamu alaikum. My name's Penny O'Connor. I'm a registered nurse and I'm now based in New Zealand. Going back a few years, I was lucky enough to actually visit Sudan, and I worked in Gadaref State for about 6 months working on a Kalarazar project. We working with nurses, doctors and medical technicians from Khartoum and all over Sudan. Amazing group of people, and you do an amazing amount of work. So I'm very pleased to hear that you're now taking on this experience of working in palliative care within your own country. My journey has taken me around the world, and I ended up in education in New Zealand before starting my new venture in palliative care here in Cranford Hospice in Hawke's Bay, New Zealand. For me, it's coming full circle. It encompasses such a wide range of nursing skills and experience. We look at people, taking them from the primary health care all the way to secondary and helping them in their last days of life. We're engaging people in their homes, in the hospice environment, inpatient unit, and we also have the privilege of giving them advice via phone. We work as an interdisciplinary team, and we are very privileged to be able to share that journey with their patients and their families. I wish you all the best on your journey and hope you really enjoy the palliative care experience in your nursing professional. Thank you.
Hi team, I'm Sharon, I'm the nurse manager at Cranford Hospice. I'm working in the community today. I've been nursing 40 years. I've been at Cranford now for 3 years. Palliative care is my passion. This is going to be my end game till I retire, so all the very best.
Hi guys, I'm Wendy. I'm one of the palliative care team nurses in the community. I have been nursing off and on over the last 30 years. Wish you all the best.
Kia ora, I'm Irene. I'm at the end of my nursing career. I'm trying to finish but have been pulled back a few days. I wish you well at the beginning of your career. It's a really great thing to do.
Kia ora guys, my name is Christina. I'm as well one of the nurses, palliative care nurses, and I love this job. So well done for choosing this route, and good luck.
Hi everyone, I'm Jess. I'm also a palliative nurse. I've been nursing for 14 years and I love it. So yeah, all the best and good luck with your studies.
All the best!
Good luck.
Kia ora everybody. Hello, my name's Janice Byford-Jones. I'm the Chief Executive at Cranford Hospice in the Hawke's Bay in Aotearoa, New Zealand. I understand that this is a really exciting time of your lives as far as your careers, and that you're embarking on something really exciting, which is a journey in nursing. So that's something that I thoroughly recommend. Having been in nursing for many years now, it gives you the opportunity to try lots of different things, have lots of different challenges, and grow as a person. I have had the opportunity to work in aged residential care, rehabilitation, critical care, the emergency practice area, and also in school nursing. So it's a really great career. It's a very challenging one, but it's one where it gives you opportunities that you can try lots of different things. So I wish you really well. Make sure that you've got some good work-life balance and some good supports around you, but have a great adventure and enjoy it, and perhaps one day you might even come and visit us here. Kia ora.
My name is Yvonne Noble and I've been a nurse now for 35 years. 32 of those years have been working with patients with a cancer diagnosis. I've worked for at least 20 years running a chemotherapy unit at a district general hospital. My current role is now an acute oncology specialist nurse, and this involves assessing patients who have a history of cancer or may be presenting with a new cancer, and they're coming into hospital because they're acutely unwell. These patients may be admitted because they are suffering from side effects of the cancer, or they may be suffering with side effects from cancer treatments. So I work alongside the emergency department nurses and doctors and the acute medical teams to advise on the treatments of the cancer complications or the cancer treatment side effects. Since my career, I've done various courses in various aspects of cancer, and now I'm able to prescribe supportive medications for patients, which is sometimes a huge benefit. One acute oncology emergency is something called metastatic spinal cord compression. It means cancer is growing and causing compression of the spinal cord, and left untreated, this could result in permanent paralysis and incontinence for the patient. In these situations, I help the medical teams to sort out an urgent treatment to prevent paralysis and incontinence, and usually patients receive urgent radiotherapy, but in some small instances they will have surgery to the spine. So my role is to help to liaise with radiotherapy teams and surgical teams to sort out which is the best treatment for that patient. My job is hard as I see a lot of very sick patients on a daily basis, many with advanced cancer. And these patients are all new to me. Unlike Jane, who may have a caseload of patients that she's come to know as a result of her, of her specialist role, mine is different because these patients are usually brand new to me as they present as an emergency. We work very closely with the palliative care teams to ensure patients' symptoms such as pain and nausea are well controlled, because this is so very, very, very important. Although my job is stressful and hard, I enjoy it greatly. I'm able to spend time talking to patients and families and offer honesty and compassion when people are facing a crisis, and also, obviously, when news is not good. Communication is key to being a good nurse, and I can't stress this enough. It's so important to develop good listening skills and supportive skills, because people need to know that they are valued and supported and cared for throughout their journey with cancer. I wish you all the best of luck with your nursing careers, and have a good day. Bye.
Hello everyone in Sudan, and hello Geraldine. Thank you for asking us to come and talk to you. It's a great occasion that you're celebrating, and your hard work and achievements are amazing. And we hear all the stories from Geraldine, and she sends us lots of pictures, and we all admire you all. My name's Jane Carroll, and I'm upper GI cancer clinical nurse specialist. So upper GI cancers are cancers of the liver, the pancreas, the esophagus, the stomach and the gallbladder. I was 52 years old when I qualified, having spent most of my time selling antiques. I felt at that time that I needed to do something rewarding that was helping other people, so I trained as a nurse. At 52, I was the oldest pupil in the class. Upper GI cancers are known as silent cancers because once a patient starts to have noticeable symptoms, the cancer has already advanced. 90% of my patients die within 1 year of diagnosis. My job is all about supporting these patients from diagnosis through their treatment and its side effects to palliative care and end of life. These patients are in shock, they're in pain, they're bewildered, they're lost, and they're sometimes angry. I need to support these patients and their families through this terrible time. This is all about quality of life, not quantity of life. It's about good communication, building therapeutic relationships, building trust, and most importantly, it's about listening and sometimes just holding a hand and showing kindness. It's about making sure patients don't feel alone. Often patients worry more about the other things rather than the cancer itself. It can be about money. Who's going to look after their family when they die? How are they going to tell their families and loved ones that they're going to die? Nursing of any kind is about holistic care. And if I have helped one patient with one small thing that's worrying them at the end of a working day, I can go home knowing that I have made a difference. Nursing is a rewarding job, so good luck to all of you.
Greetings to you, Geraldine, and all your wonderful colleagues and your new community of nurses undertaking the Bachelor of Science Nursing at Comboni College. We heartily congratulate you on this amazing endeavour to arrive at this point and to achieve so much in this quest to bring nursing to your community, to your whole country across Sudan. We are utterly in awe of how you have continued in this vision, and we would hope that in any way St. Christopher's here in London would want to support you and travel with you in any way that you think we can. For me, I've been nursing for 40 years and still love the job. I will never forget the amazing nurses I've worked with who really give me and continue to give me a real respect for our profession and the tremendous opportunity we have working in end-of-life care to really travel with patients and their families when they are most vulnerable and most in need. They will never forget your kindness. They will never forget your presence. And they will never forget you being there when everybody else is no longer able to offer treatment or therapy. The nurse remains to accompany the person and their family to the end and beyond. And you will stay forever in the hearts of those families and be part of their story and as part of their remembering what really mattered for that person and helping them to hold good memories because of your kindness, your compassion, and your professionalism, the ability to see the critical needs, to be aware, and to keep asking what else matters to you. So I would say, in terms of my experience, when my father died 10 years ago, I will never forget the one particular nurse who made such an impact on me. In all my career as a nurse, I will never forget Beverly. My father was in hospital, dying. We wanted to get him home. He only weighed 40 kilos, so he was very thin, and we were worried about his skin. So Beverly, the specialist nurse, came to see him, and she introduced herself. But the first thing she did was, having said hello to us, went straight to my father, knelt down beside him as he lay on his side, and they spoke together. And in that moment, it was just two of them. She went straight to him and said, how are you? What is important to you? What can I do to help you? And together they devised a plan. And then she brought us in as the family to say, this is our plan for your father. I thought that is exactly what end-of-life palliative and good care looks like. Asking the person what matters to you first, using that as a direction of travel, and really enabling that to inform the care and the expertise that we bring to that particular situation. So thank you for this wonderful opportunity to support you in this amazing day. And Geraldine, we are here in any shape or form we can do to help you. And we wish you all the very best as you progress into your studies, and hope that you too will find that you have chosen a profession that is so critical and can make such a difference to people's lives. Go well.